Hi, hello, welcome. Morphologically, cranial nerves can be classified into three different varieties: oculomotor, trochlear, abducent, and hypoglossal nerves supply muscles derived from cranial myotomes. These are the muscles derived from cranial myotomes, occipital myotomes, and preoccipital myotome. Preoccipital myotome gives rise to muscles of extraocular group supplied by cranial nerves 3, 4 and 6. Cranial number 12 supplies occipital myotomes which develop into muscles of tongue. Cranial nerves. This is brainstem showing nuclei of different cranial nerves. Observe here, this is oculomotor nerve nucleus, trochlear nerve nucleus, abducent nerve and hypoglossal nerve. All these being general somatic efferent, they lie in line from midline to medulla. 12th cranial nerve passes below the tongue to give motor supply to most of the muscles of tongue. Hence the name hypoglossal. Learning objectives for hypoglossal nerve are mentioning the nuclei and functional components, explaining the course and communications, describing the branches and distribution, and few related applied anatomical aspects. This picture shows posterior part of the brainstem. This is floor of the fourth ventricle. In the lower part of the floor of fourth ventricle, we find hypoglossal trigone and vagal trigone. At the level of hypoglossal triangle, when we take transection, here it is, we see hypoglossal nuclei on either sides. Hypoglossal nerve escapes anteriorly out between the pyramid and olive from the front of brainstem. Hypoglossal nuclei of one side is ipsilaterally controlled by the cerebral cortex. However, contralateral fibers coming from other cortex control that part of the nucleus which innervates Januglosses. Hypoglossal nerve innervates muscles of tongue which develop in occipital myotome. Myotomes give rise to body wall muscles. Hence, the functional component for hypoglossal nerve is general somatic efferent fibers. It is good to remember here that third, fourth, and sixth cranial nerves have general somatic efferent fibers which supply preoccipital myotomes. Nuclei of third, fourth, sixth, and 12th cranial nerve lie in same line. This is front of the brainstem showing medulla and pons. Hypoglossal nerve arises between pyramid and olive. You can observe the rootlets of hypoglossal nerve are 3 to 4 in number. They lie in line with abducent nerve, oculomotor nerve, and also trochlear nerve. However, trochlear nerve is not seen here, which takes exit from the brainstem from posterior aspect. Once hypoglossal nerve comes out from this area, it takes entry into hypoglossal canal. This is where it is shown. It lies just anterolateral to the occipital condyle. This is course of hypoglossal nerve in carotid triangle. In carotid triangle, it lies lateral to vagus. It turns forward, making an arch, lateral to both internal and external carotid arteries. Occipital myotomes, they migrate from occipital side to the lower part of the mouth. That's how the nerve supply, hypoglossal nerve, is also pulled forward along with occipital myotomes. That is how the relations of hypoglossal nerve is lateral to vagus, lateral to internal and external carotid artery. This is course of hypoglossal nerve in digastric triangle. Once it enters anterior to the lingual artery, which is here, it is entering into digastric triangle it lies superficial to hyoglossus muscle and takes entry deep to mylohyoid. After going and reaching the lower part of the base of tongue, it supplies all the muscles of tongue except palatoglossus. This is diagrammatic representation of tongue. Intrinsic muscles are within the mass of tongue. All the intrinsic muscles are supplied by hypoglossal nerve. Extrinsic muscles are seen here. They are styloglossus, hyoglossus, and genioglossus. One more is from above, from the palate, palatoglossus. Except palatoglossus, whatever muscles are seen here, all these are supplied by hypoglossal nerve. Observe here, genioglossus is bulkiest muscle of the tongue, which arches till the tip of the tongue, which is helpful for protruding the tongue. Dark green colored path in this picture is of hypoglossal nerve, which supplies most of the muscles of tongue. Hypoglossal nerve can be seen here. Apart from supplying tongue, it appears to be supplying thyrohyoid by this branch and geniohyoid by this branch. Indeed, thyrohyoid, geniohyoid are infrahyoid and suprahyoid group of muscles which are supplied by cervical segment 1. You can see here, C1 fibers are along with hypoglossal nerve. They travel along with hypoglossal nerve. They supply thyrohyoid and geniohyoid. Indeed, these fibers are not from hypoglossal nucleus. In the same manner, descendens hypoglossae. This is a root given to formation of ansa cervicalis. It is not directly branch of hypoglossal nerve. These are C1 fibers which are leaving the hypoglossal nerves to form ansa cervicalis. Apart from C1 fibers, hypoglossal nerve also has communications with lingual nerve, which is branch of mandibular nerve. This is how it gives proprioceptive sensations from muscles of the tongue to lingual nerve back into mesencephalic nucleus of trigeminal nerve. This is superior view of tongue. These are genioglossae of either sides. When they contract together, they push the tip of the tongue outside in the midline. Genioglossus is also known as safety muscle of tongue because slightest amount of pushing the tongue forward maintains the patency of airway in oropharynx. For example, in unconscious patients and those who are recovering from general anesthesia can have fallback of tongue into their oropharynx if they are sleeping in supine position. Genioglossus is also clinically helping us to identify whether hypoglossal nerve is patent on either sides or not. We test hypoglossal nerve by asking the subject to protrude the tongue out of their mouth. When they protrude, if tongue tip deviates to one side, that means genioglossus of that side is not acting. Deviation is because of push of normal side. Ipsilateral deviation of tongue on protrusion in lower motor neuron lesion of 12th cranial nerve. However, contralateral deviation can happen in upper motor neuron lesion because on that side the nucleus responsible to supply the genioglossus is controlled by opposite cerebral cortex. This ends the session on hypoglossal nerve.